thank you all for taking the time to hear our pitch. Let me introduce you to both our idea and our team. The idea for the call light system was developed by a team of four student nurses who recognized the pressing need for improved communication between healthcare staff and patients, particularly those who do not speak English as their first language. As future healthcare professionals, we understand the impact that language barriers can have on the quality of care and the patient experience. Our team comprises of individuals with diverse backgrounds and experiences in healthcare, which allows us to approach this project from different perspectives. Each team member played a vital role in the development and the refinement of our call light system. The four student nurses, including myself, had various roles within this project. Together, we brought together previous learning from within the BSN program relating to patient care and cultural sensitivity. We focus on the technical aspects of this project, including the design and functionality of the call light system. We also led the user testing phase and gathered valuable feedback from healthcare workers and patients to improve this prototype. Throughout this project, we also received feedback from registered nurses, other student nurses, non-English speaking patients, and English speaking patients. This input played a crucial role in shaping the call light system to ensure that it addresses the needs of both healthcare providers and patients. Imagine being a patient in the hospital. You're feeling vulnerable, you're anxious due to a medical condition. Now imagine not being able to communicate these needs clearly to your healthcare team because English is not your first language. This is the reality for many patients in the hospital today. This can lead to feelings of frustration and helplessness. We want to bridge this gap in communication and provide these patients with a voice and a way to express their needs effectively. This project is deeply personal to us because we've witnessed the struggles faced by non-English speaking patients and their families within the healthcare setting. We understand the importance of clear communication and providing quality care and ensuring the patient's safety. This motivated us to create a solution that enhances communication between the staff and patients. As future nurses, we've all been in the situation where we were not prepared to enter the patient's room. Most of the time, it's because we didn't have the materials that we needed. We enter the patient's room, we ask how can we be of assistance, we leave the room to fulfill the request. The current call light system is not specific with requests, leading to underpreparedness and poor time management. Imagine being a nurse rushing from one patient's room to another, trying to meet their needs as efficiently as possible. Now imagine how it would feel to enter the patient's room already knowing their request and being able to address it immediately. This is the vision that we hope to create with our call light system. The problem that we aim to solve is the significant communication barrier faced by non-English speaking patients in hospitals. These patients often struggle to express their needs to healthcare staff, resulting in delayed or suboptimal care. This lack of efficient communication can lead to misunderstandings, increased stress for patients and their families, and potential medical errors. Along with this problem, we also aim to solve the problem of healthcare staff entering rooms unprepared and needing to make multiple trips to gather their supplies. This lack of preparedness can lead to delays in care and increased frustrations for patients. The target population that we focused in on are non-English speaking patients and their families, as well as healthcare staff such as nurses and other providers. The communication barrier in hospitals is a widespread issue affecting millions of non-English speaking patients and their families globally. In the United States alone, approximately 25.9 million people speak English less than very well and may face challenges within the healthcare settings. Research has also shown that communication failures in healthcare settings can contribute to medical errors and inefficiencies. A study published by the JAMA Network estimated that communication failures account for approximately 27% of all medical malpractice claims. The lack of efficient communication not only affects the patient care, but also has significant financial implications for healthcare systems. Miscommunication can lead to longer hospital stays, readmissions, and increased medical errors, all of which contribute to higher healthcare costs.
The current available solutions are not necessarily as innovative as our prototype. So what is currently available for interpretation services includes the Voicey interpreter device as pictured on the left, which is a mobile device that can connect the patient with a language interpreter. There are over 240 different languages that this machine will be able to connect with the patient. But with even with this system, there are still gaps in innovation. And the traditional call light on the right is what most hospitals use for their call light system. And as you can see, the buttons are pretty generic. They don't necessarily have as many symbols on them as what the patient may need. And they're in English. The titles are in English. So for a non-English speaking patient, this call light system is not the most effective. Rather, symbols would be better for a non-English speaking patient. So we were hoping that finding this gap in the innovation would help to create a prototype that brings together both the interpreter device and the traditional call light.
Our solution not only will help patients, but will also help nurses. So we have come up with a tool that combines both the traditional call light and the available interpreter devices. So as you'll see at the top, there are buttons that can be customized with symbols so that they are understood by the majority of patients. And there can be things like medications, questions, need for nurses, bathroom needs, so that way it will get sent right to the nurse's device so they will know what to bring into the room or what to be prepared for. In this way, they can also prioritize which patients to go to. And then next you'll see a speaker, and that can be spoken into and heard by the patient. And then one of the most important parts of this is having language options as well as a translator. So we have buttons there that you can switch between languages, translate, and speak. So there will be an option to type or speak into the box. And this way it provides a quicker and easier communication between the patients and nurses. And it will connect the same way as a normal call light would, but it has a lot of options to be customizable and overall will create a more efficient and safe care for the patients.
So we anticipate the implementation costs and needs to be with the hospital and Voicey technology or another interpreter device system. I'm hoping to bring both the technology from the hospital and Voicey together. And along with this, we would hope to collaborate with the IT department in the hospitals to provide education about how to use these new technologies. And then we also understand that as much as this would take fiscal money, we also know that staff's time is worth money as well. So having to train the staff in how to use these new call lights is something to consider for implementation costs as well.
As we wrap up our presentation, I want you to think back to how you would feel if you were in a situation where you were unable to communicate your needs to the healthcare team, whether that be due to a medical condition or English not being your first language. Now, with our proposed new collaboration with Voicey and our call light system, there will be a much easier way to communicate with your healthcare team. This new technology will enhance communication worldwide, as seen. The new call light system will not only have specific buttons for commonly called for items, but will also have the exact needs to let your healthcare team know. Before I leave you, I want to express how passionate we are about this call light system. All of us are in our last semester of nursing school, as well as worked as patient care techs during the summer. We've spent countless hours in the hospital setting and have been able to witness firsthand the difficulties that a communication barrier has on both the nurses, patients, and families. It is important to us to have created something that will benefit the way we can care for our patients in the future. Nurses spend the most time with the patients, and we believe that our new communication system will change the lives of so many. We appreciate your time and hope you enjoyed learning more about our call light system. For any additional questions or information, please feel free to contact us here. Thank you.